And as you all know, the effects of trauma are exceedingly variable. People vary in their response to what is called trauma. And so it depends very much on the resilience of inner psychic capacities. So clearly this must have something to do with the internal modalities that process our psychical input of the external reality. Now, I have in the past described these internal modalities briefly as two simultaneous and ongoing processes, experiential modalities that are essentially based on two opposite factors. In one of them, we experience self and other as fused and merged, as together, as connected, which also has to do with the experience of feeling alive and connected. And in the other modality, we feel and experience self and other as separate from each other, which gives rise to a different kind of experience. In the interest of brevity, I have sometimes referred to these two as being and doing because they lead to something of that nature. But the essential point is the merger on the one hand and the separateness of self and other on the other. Now, studying trauma in various contexts, such as bereavement, loss, the Holocaust and its aftermath, terrorist attacks, and so on, I find that what is essential in trauma, or what is essentially traumatic, can be described as the interruption or breakdown of this experience of aliveness, connectedness, and going on being, of feeling oneself together with, merged and connected with oneself and with the other. And when this breaks down, it leads to the negative of this experience, namely, rather than being, we are confronted with an experience of non-being, which you may think of as the experiential manifestation and expression of the death drive. Now, non-being affects our psychological faculties and capacities in many ways. It affects our thinking, our reality testing, our capacity to plan, but most of all, it really undermines and causes for a loss of our symbolic capacity. And symbolic thinking and the ability and the capacity to symbolize depend very much on this ability or capacity to connect with another and essentially with a third that encompasses both us and other, because then the symbol has a meaning not only privately but communally. So rather than the symbolic capacity, we are met with the ascendancy or domination of something that can be described as unsymbolized, real, or concrete. Now, so much for some attempt to describe the effects of trauma in general. I'd like to focus now on communal trauma. What happens in communal trauma? Communal trauma, first of all, represents an attack on this capacity for being connected, together with, belonging, part of something that is essentially greater than ourselves. It could be the family, community, the nation, society, a religion, an ideology, or what have you. But it rests on this disruption of this capacity to belong. I want to remind you of an example that Freud uses in his paper on group psychology, which is an interesting one. He talks about an army unit that falls apart under some kind of external danger. what we might easily call a traumatic experience. Now, Freud argues there that it's not the external danger that causes the unit to fall apart. What causes it to fall apart is the disruption of their libidinal ties, as he calls it, and their identification and togetherness with each other in the unit, and the loss of leadership. The example that he uses is the apocryphal story of Judith and Holofernes, and Judith, as you know, murdering Holofernes, who is a command of the army, and then the entire army flees. Now, regarding trauma, therefore, through these two lenses, if you will, like in Bion's binocular vision, experiential dimensions on the one hand, and the group dynamics approach on the other, I think we can identify these two things as the central factors in communal trauma: the loss of the connectedness of the being dimension and the decline or loss of leadership. One result of such a process would be that values and norms become undermined. When this feeling of connectedness and so on takes place, one of the first things that are attacked and destroyed is the common adherence to and sharing of values and norms, as well as the connection with a benign, enlightened authority and leadership. And this leads quite often to group and institutional or organizational paranoid regression, and even to the ascendancy of social corruption. And you may think of the current rise under the conditions of the seclusion and the lockdown during the corona pandemic. There's been a rise of in-family aggression and of child abuse has been reported. Another result would be a greatly increased need for togetherness with others. This COVID-19 social distancing and lockdown has led to a tremendous need for connectedness. And consider all the WhatsApp groups and the Zoom meetings and the tremendous relief expressed by people throughout these meetings. It's been quite an experience to greet each other, even if it is just on the screen. There's also been an idealization, well-deserved idealization, I must say, of the medical profession, medical teams, which I think has something to do with the need for leadership and for heroes that one can look up to. Now, let me say something before I close about how this affects the analyst and the patient. A communal trauma is a trauma which both analyst and patient have endured together. They have both endured the same trauma, whether it's a terrorist attack, an earthquake, or a COVID-19. Both are the victims and the survivors of this same collective trauma. And so the usual loneliness of the analyst, of which we don't tend to speak very much, but it's something that does exist. This loneliness tends to be exacerbated. And under such conditions, the analyst may feel a great need for comradeship. And this comradeship may lead to a connection with other analysts, but it may also lead to needing the comradeship with the patient and the analysand. So I think this situation presents us with a great challenge, a real challenge. The challenge is, will this undermine what we call the transference? Will it change the setting or lead to an abandonment of the usual analytic stance and role? Will our traditional setting be forever changed, perhaps even abandoned? I think these are very important questions that we are looking at, we're beginning to study, and that will need a lot more work to pursue. But obviously, what we need is to exercise compassionate understanding while maintaining the analytic role. And actually, I think this can be described as the analyst's leadership function. Thank you.
Thank you very much, Shimon. Very interesting. We'll move on to our next presentation at this time. I'd like to introduce Dr. Mario Carini. He is the co-founder of the Associazione Il Nodo in Turin, Italy. He is a psychiatrist and a psychoanalyst, a member of the Italian Psychoanalytic Society, the IPA, and also the International Society for the Psychoanalytic Study of Organizations. Thank you. Go ahead, please, Mario.
Thank you. I'm so glad for being here. And my presentation would be about spaces and symbols of fear. We're focused on fear, on this kind of emotion, and the way it is experienced and dealt with by individuals, group, and societies or large groups. Well, I'm sorry, but I have to read because my English is not perfect. Epidemics are not just a health problem. They also imply social, cultural, political, financial, and also psychological processes, which require complex, multidimensional approach. Besides being a terrible memory of the past plagues, they have recently also become a present nightmare, a source of individual and collective fears, so much harder to bear in that they symbolically represent all the unseen or disavowed insecurity, complexity, and vulnerability belonging to our current life in this fast globalized world, as well as the archaic anxieties and the nameless terrors belonging to every human being's early childhood experience. In short, an epidemic of fear. First, the fear of contagion is a fear of the invisible, something that is among us but cannot be seen because it is too little, like a virus, or too big, like the spreading worldwide of a pandemic, or too familiar but somewhat uncanny. This reminds me of Freud's concept of unheimlich. Some familiar but uncanny, like air, water, food, the next door neighbor, or worse, our friends and our beloved ones. As the enemy is among us, or even one of us, the paranoid defenses tend to transform the epidemic of fear, and even more of confusion, into an epidemic of mass suspicion toward the other as a plague spreader. This role is, for the moment, taken, for instance, by the secret Chinese laboratories. I think that some such paranoid transformation of mourning may well serve to fight the depressive view of human frailty and also a related fear of abandonment. While conspiracy theories that are spreading worldwide, involving the idea of malignant, omnipotent organizations acting in the shadow, may offer some reassuring, even though somewhat delusional, certainties. If confronted with the discouraging evidence that faced with such a storm, maybe there is nobody at the helm. Well, in the case of COVID-19, a totally new disease, there is also the fear of the unknown or the unpredictable. But this raises a difficult, for me at least, difficult psychological question, whether fear is more triggered by what is completely unknown or by what is somehow deeply known but still unbearable and therefore impossible to think and articulate. I have in mind the concept, the Bollas concept of unthought known. Well, in order to try to manage social processes like this COVID-19 pandemic, involving anxiety, fear, and panic for thousands or even millions of people, we need to better understand these human emotions, namely the way they arise and develop, what may enhance or mitigate them, what are their psychological and social dynamics, which defense mechanisms they mobilize, and how do they impact on individual and group behavior, as well as on organizational functioning. Some useful distinction, in my opinion, would be first between normal and pathological fear, where the former, however useful for survival, might prove unbearable, and the latter, as a disguised expression of internal dangers, is generally inaccessible to evidence, reasoning, or reality testing. Second, between psychological defenses, like repression, projection, or denial, working on an individual basis to keep fears out of the mind, and social defenses, like authoritarianism, scapegoating, or intergroup fight-flight dynamics that try to remove them from collective consciousness. Maybe something that Shmuel was talking about communal trauma. Third, between the distinction between defense and protection, where the latter acts as a container for primitive anxieties, also at an institutional level, to protect individuals and the environment from their potential damages, such as stress, mass panic, and social paranoia. Well, the first shield against all fears is the mother. Later on, the family or its social and organizational equivalents, the government, the healthcare, the mass media, as long as they can remain able to listen and to concern. That is, to act as a good enough mothering system. Well, a bitter and scaring discovery now from the current COVID-19 pandemic is that we all are orphans. Namely, we are both motherless and fatherless, because all social institutions turned out to be unable to offer a maternal protection, maybe an idealized maternal protection, against a threatening world, as well as a paternal guidance oriented by a shared, reliable knowledge. Another point could be the space dimension of this epidemic of fear and its symbolic elements. For example, social distancing, a sensible strategy for reducing the risk of contagion, ended up establishing in the collective mind a configuration of outside versus an inside, while these two spaces are now experienced as competitors and therefore cannot be easily integrated. As a result, outdoor life, squares and beaches, nightlife and restaurants, travels abroad, all these symbols of freedom seem unable to negotiate with lockdown, homeland rhetoric, taking refuge in domestic spaces, or in the inner world, which tend to represent safety. When primitive fears are overwhelming and split become dominating, the outside may turn to be a bad place because there we have the viruses, the strangers, the enemies at the door, while people isolated in a good inside space may feel protected by their family or tribe, by daily routines, personal beliefs and biases, although this safe isolation may become an antisocial drive, leading first to withdrawal and mistrust, then to exclusion, ostracism, or even persecution of the scapegoated other. One could also argue that there are also transitional spaces, bridging the gap between inside and outside, from international relationships to house windows and balconies, and also the digital space with the smart working, e-commerce, new media. But we cannot escape from conflict and ambivalence, and the evidence that closeness and intimacy may become a risk. Squares filled with crowds may host a rebellion against authority, or simple a mindless denial of dangers. Homes where partners or families have been forced to stay together all the time, often in narrow spaces, may turn into places inhabited by growing stress, intolerance, and even violence outbursts. The same balconies where people were singing together and applauding healthcare workers showed other people shouting insults against an infected neighbor who was being taken to hospital. I'm at the end for concluding. What psychoanalysis might help us to achieve now and to maintain as a good enough vaccination against an epidemic of fear could be essentially awareness and thinkability. An attitude combining the courage to face a frightening truth with the capacity for thinking, a collective mental space to work through those fears by means of what Bion called patience and the negative capability, namely by developing a kind of weak thinking and a deeper understanding of the problem rather than resorting to action to a strong set of how-to prescriptions or to impulsive and mindless actions driven by fear and its defenses. Well, after all, what we need to learn from the experience of the pandemic is how to reimagine human relations beyond this manifest collapse of a culture of omnipotence by taking time to pause, make sense, and connect, and then act better together. Thank you.
Thank you very much, Mario. Thank you. We'll move to our third speaker, Dr. Zachary Green. Dr. Zachary Green is a professor of practice in leadership studies at the University of San Diego Nonprofit Institute. He is also the co-founder and director of Group Relations International. I'll leave it at that and ask to hear from you, Zachary. Thank you.
Thank you very much, Harriet, and I really appreciate the opportunity to be a part of this panel. I'm not a part of your organization, and I recognize that I'm a guest here. I represent a perspective from organizational development and from 30 years of being a practitioner of group relations study, also directing a number of conferences in that respect. So what I'm going to be presenting is psychodynamically informed as opposed to purely psychoanalytic. There will be elements of it that will be familiar to you, but they will also be borrowing from other disciplines. What we're going to do now is we're going to look at a slide that will help you sort of navigate where I'm going with this. And what I did, along with my colleague, David McCallum, who's a Jesuit priest and also a doctor in terms of his PhD, in terms of human development, we looked at what was going on early in the pandemic before the infection rates became what they are in the United States. And we began to wonder what might be a pathway out of this, and what might this look like, and what did we understand about our own behavior at a collective level, much as what Shmuel already spoke to, and then Mario spoke to as well, is that what we began to look at is the social defenses that were emerging. But what we decided to do was look at this at the individual level and the collective level concurrently. And so what you have here is a sort of model that was adapted from the wonderful work of Suzanne Cook-Greuter, who's a leadership scholar, who said that there is a pre-conventional, conventional, and post-conventional capacity of thinking, behavior, and human development. And so what we did is we decided that there's a pre-contagion, contagion, and post-contagion mirroring of that same process. Pre-contagion meaning that before the number of cases in a particular context begin to emerge, the kind of attitudes and defenses that are used in the face of that. Then when the contagion erupts, and that's what the orange curve represents, is then what kinds of things begin to happen then. And then as we begin the end of the process and the potential reemergence, what do we see as post-contagion in terms of the kinds of social defenses? So that's the short version of it. What is important is that I will be presenting it as if it is linear, but in reality, there are all kinds of regressions and loops and interlocking and concurrent elements. And what we're also going to be doing in a moment is asking you at each of the pre-contagion, contagion, and post-contagion stages is to do a quick poll, because we're trying to find out if the kind of naming that we're giving to these stages makes sense and whether they are visible in your context. So let's do the first three. In the pre-contagion, what we believe is the process is one of ignorance, indifference, and denial. And by that, what we mean is that the ignorance is a kind of primitive sort of a splitting off of the process. And so that one can deny that there is any element of this present in our current context. Through this, there's an indifference that pushes this out of consciousness, and in doing so then has this feeling as if this is not my experience. And then, of course, as there begins to be more and more presence of the virus in one's context, then the initial response is more primitive and one of denial. So our quick question to you is that which of these have been characteristic of your particular context? And we'll give you about 30 seconds to a minute to respond, and you can click right now. Few more seconds. Okay, let's see where you are with it. Okay, what we're seeing is that amongst you who took this poll is that denial is one that you saw very strongly in your particular context. In the United States, what happened was that there was a great deal more of a propensity towards indifference, and then the denial showed up. So that's very helpful. Now let's go back to the slide and let's talk about what happens once we continue. So what begins to happen is that as the contagion begins to increase, the nature of the defenses begins to change. What we have here is contamination, and David and I already know that that's the wrong name for it. But what we do know is that once the contagion begins to enter into a new context, there's a wish to blame, and therefore the need to project that blame onto someone, some person, some group, to say that you are responsible for my contamination. In addition to that, in terms of individual collective process, as Mario already alluded to, then there's also a propensity to look at some other who was previously a friend, a colleague, a coworker, as a potential form or source of that contamination. And so that projective process becomes incredibly powerful. As the number of infections increase, as restrictions begin to happen, as shelter-in-place orders come into being, then the panic ensues. And that panic is because of the real emergence of the death drive and the concern that this is not something that is no longer out there, but something that really can be located in me. And it becomes a collective process that then in different countries in different ways goes into all kinds of behaviors that are meant to protect one in the face of the pandemic, but in reality are simply defenses against it. What my friends and I have recognized is that in our more undefended moments, each of us have moments of somatization and have this sort of like sense of fear that this is happening to us. We also recognize that there is this, because of the level of isolation, a kind of a return of the repressed in many kinds of ways, where in the isolation, then we have this confrontation with aspects of ourselves that our day-to-day life would perhaps have us defend against. Then the next part of that is then, okay, this is all happening. The panic didn't solve this, but now there's chaos. There's a need to find order. And then absent routine, absent of being sheltered in place with people with whom provide a sort of nurturing and holding experience for us, then what we begin to do is then try to find a way to organize and integrate this. But this is not just at the individual level. The collective attempts to try to find some way of organizing this experience, until which time is there is something often external, as Mario alluded to, the idealization of government or groups or processes as mother, someone who can hold us and provide us that sort of mirroring that everything is going to be okay. In the failure of that, then we also have to find this containment for ourselves. So now we're going to do the second poll. So the second poll is on these four. Of these, which of these have you seen in your context? Contamination, panic, chaos, and containment was written first. Okay, so let's see. Contamination, panic. What is the actual language so that you know what the fourth one is supposed to be? Panic, chaos, containment. Okay, let's just go with that. Let's go with the poll as it is, recognizing that we'll have to add, don't use the last containment, please. Oh yeah, I see what I did. I misread my own poll. A little anxiety on my part. Okay, let's see our results. What we see is the chaos, yes. Absent some sense of order, absent some sense of knowing that this can fall into a routine, we see the chaos showing up. And then what we have is too often the failure of containment and the failure of sense of that there's some object, some group, some way of being able to work with this. That's fantastic. Thank you. And now the final set. When this paper was written, there was nothing in the United States that suggested that we were going to reemerge from that. As a matter of fact, Los Angeles County, which is just north of me, has been told that they will have shelter in place for an additional 3 months. While some parts of the world are emerging, this isolation then leads to the potential of two different expressions. The isolation can really lead to a sort of a depressive mode, if you will, that begins to emerge for some. But for others, there's a sublimation, a movement of this into activities that sort of bind the anxiety, but really are underlying expressions of that anxiety. But there are also these moments of patience as well as altruism that are beginning to show up, which I do believe are authentic responses to that same anxiety. But they are not as well developed, as well formed as more primitive defenses. So in the isolation, those are the potential, but also in this isolation is the grief and mourning and the devastation that will then be a reckoning for all of us, not only in terms of the individual level, but also what we've done to the planet and how that's understood. And the emergence will then allow us to see that more boldly. And then a lot of people are writing about the potential of renewal. David and I have some question of whether that's actually going to happen, or whether there will simply be a regression to some false sense of normalcy, sort of an illusory state. So then we're going to poll you again and ask you in your context, which of these three are you seeing, if any? Okay, thank you. And let's see the results. Yes. The question of renewal is one that we share. My co-author, David McCallum, really are wondering about the human capacity to not only repress, but to regress to previous ways of functioning. There is a potential of some emergence, but the blend of what isolation represents is very powerfully present as we begin to re-emerge into the world. So let's close that and we can go back to my slide. And so this, as I said before, is not a linear process. This is a working paper, but what we do is offer it to you as a way of thinking, and then how the collective process and the individual process are functioning concurrently, and how we can then perhaps better understand our pathway forward. Thank you.
Thank you very much, Zachary. Thank you all. This has really been an unusual opportunity. I think, Shmuel, you introduced us to inner psychic capacities as determinative of level of trauma, taking us from there to communal trauma. And Mario, you took us to the symbols and spaces of trauma and this tension between inner and external, and how potentially chaotic and traumatizing that is. And Zachary, you've shown us that this is a process. You've reminded us, I think, not only that it's a process in general, but that we are right now still at the beginning of a still longer process. And we're very much still in isolation as opposed to understanding what the future holds. So I would like to ask you if you have something to say to each other, and then we'll open it to questions from the audience. I'm sure there are many questions. Do you have a thought that you'd like to share with one of your fellow panelists and the rest of us?
Shmuel, I wanted to talk to you about the communal trauma, because one of the things that we're working on right now among my colleagues is that we're talking about a concept that we're calling intersectional trauma, whereas there is indeed the shared experience of what you're calling communal trauma. But there's also a wondering about the historical trauma, especially certain groups carry, and how this is activated by the collective trauma. Then people who've experienced their own personal trauma, and then the vicarious trauma. And so that how all of these are happening at the same time, and then one cannot locate themselves in this because they don't know which one is activated because one expresses the other. Do you have some thoughts on that?
Well, first of all, certainly that's quite true. And I think, you know, rather than the other side of that coin would be not the difficulty of finding oneself in it, but actually the preference for finding oneself in it. Because this kind, if I understood your description, this kind of communal historical trauma can often be something which unites people and becomes part of their identity. I mean, I can easily think in our Israeli context of the Holocaust as a combining, identifying trauma. I think there are other groups that share this. Actually, Vamik Volkan, I think, has talked about that kind of group trauma. And so I think, you know, there must be two sides to that coin.
Okay.
And therefore, my preference would be, if you look at an individual, you'd have to ask why or what is it in him or in her that makes it difficult for him to share in that common trauma. Why is he in a way feeling the outsider? And on the other hand, you can ask the group, why do they need to maintain this trauma as their collective identity? Just one other thought. In a conference that I did once, there was a large group of Serbians, and it was amazing that what holds them in some strange way together is a battle that took place in, I think, 14 something, and that they won, and they defended Europe because they defeated the Turks, then they stopped them. And that is the basis of their identity to this day. Nobody knows about this, but within the group, of course, it's very powerful. So it works both ways, I would think.
We slightly disagree on this, on one element of it, because what we are looking at is that in terms of the history of enslavement, that this collective trauma then is activating the kinds of oppressions, and that there's enactment and the acting out at a collective level of denigrating the other in such a way that then what we are facing is not only the collective trauma, but also the legacy of the enslavement. And so that these two things are coming together. Mm-hmm. And then we're having an experience of being hit by both at the same time. So yes, it is a form of identity, but it also can be put into the larger context, a bigger challenge. So we'll have to continue to have this conversation.
I think you're saying that this larger trauma has a historical and a current impact on the social identity of the group, of the entire group. Yes.
Yes.
Mario, would you like to comment on this?
Yes, I have. There's an association that came to my mind a week more or less ago. I read a post on a social media where somebody asked whether this pandemic could be considered like a psychotic general phenomenon, a psychiatric problem. Not just affecting people that were maybe mentally ill, but a kind of spreading of a psychotic, confusing state of mind. The chaos in Zachary model, I think it was 43%. The polling underlined this state of mind particular. And I would like to connect it with what Shmuel were describing, talking about communal trauma as an attack at the capacity of connectedness. In my view, this is something to do with Bion's concept of attack to a linking. In a sense that maybe an attack on linking happens at a mind level, individual mind level, and an interpersonal level, and in the communal or societal level. And in the mind, in the group, in society, the lack of connection is maybe not just an isolation, but a fragmentation of not only of relationships, but also on the Weltanschauung, the way to see, they see the world and its meaning, the future. There are some people that say, oh, well, it will be all like before, after, when we emerge, in a sense. Some people say, no, it won't be nothing like before. It will be all changed. And I think that these are two ways of cutting the links between a feeling of confusion that I don't think is psychotic. I think this is more psychotic, saying, I'm sure of what is going to happen. Something that reminds me of, if I remember well, Donald Meltzer say of delusion of clarity of thinking. Well, in Italian is different. Well, and so I think that apart the question of identity trauma, I think that this trauma is destruction of the way to see reality, because reality has to be not interpreted on the previous basis, but has to be discovered again. We don't know what will happen after. Renewal, maybe, isolation, maybe, the syndrome of the hut. I say that somebody says, you know, after, when all is over, I stay at home forever. Some people, I don't think they are mad, but they are talking like this. Well, this is what I happen to think.
Mario, your thoughts about cutting the links make me think about a sort of, from a psychoanalytic point of view, a regression to the paranoid schizoid position that so many are in this setting of uncertainty. And whereas one of you spoke about the idealization of the medical people and the frontline workers, there is at the same time a denigration and actually a level of violence they've been exposed to. There have been murders of doctors because they are perceived as the carrier of this invisible threat. So, you know, on both sides of that splitting, people are in an intensely aggravated state of mind.
Yes, I think that this point of idealization of healthcare workers, I saw from the I talked about the balconies. From the balconies, people clapping the hands for our heroes. I don't know if in other country there is the same imago of the healthcare worker as a hero. Close to the hero, we have the martyr. To be a hero, you cannot survive. You must die in glory on the field as a brave warrior against the virus, against the enemies, against the plague spreaders. But you must die. If you do not die, and my colleague in hospitals or in other healthcare places are already scared of what they are going to pass after the end of the pandemics. They are nearly sure they will be no longer applauded, but instead accused, insulted, biased, and maybe taken in front of a judge to respond to all the death.
Right.
And I think that in my mind there is a comment. You know, in Italy we have a special state that is named Vatican, and we have the Pope inside. The actual Pope, I discovered that had made a psychotherapy for 1 or 2 years with a woman, an analyst, Jungian. And so I think that he knows psychoanalysis better than the church can admit. But he said once the Pope was being drawn on a wall of Rome like a Superman, in flying with his white dresses, just like a Superman in a sense. And a journalist asked him, but what do you think about this? Well, I don't like this kind of image of representing me. I don't like it at all. Because if I remember well, Freud said that behind any idealization, there is a denigration. I think that this is what we should be prepared to face.
I would like to start moving to the audience questions. The first one I have here is the United Nations warned about a massive psychological crisis due to the COVID-19 pandemic. If countries do not pursue measures, what do you think of this? What measures should be taken taking into account the idea of communal trauma? I think our question is asking us to think a bit more concretely, pragmatically about actions that governments might take, given your insights.
I think I just want to comment on that because I've been thinking about this now for the last few minutes, that one dimension that we have not really touched on and that is connected with these things in the real world is the political. And I think this question addresses that level. And, you know, it's really very difficult to jump from psychological, psychoanalytic, group relations kind of insights to the political level. I don't know if what Mario was just telling us about the Pope having had psychotherapy, if that would have helped. You know, there was once, I think it was in the United States, when Greenson said, let me have this president on the couch and everything is going to be solved. I don't think we can really say very much on that, but I think it comes back to the leadership issue that I touched on, which is that there is, you know, this is where the political and the psychological come together. The leadership in these various countries, my own and I think the others as well, has not been a model in a way of what I call an enlightened authority, an authority that can, perhaps to use Mario's expression, act both maternally and paternally and provide a container. So where does one get that politically is of course not for me to say, but it is that kind of leadership, if we can get it politically, that would be, I think, a very important factor in getting out of this pandemic.
I want to agree with you, Shmuel, because I think that the political dimension of this is understated in terms of its psychological impact and how many people are vulnerable to more totalitarian kinds of thinking because of this and the wish of having some object who can provide solace and sense of safety amidst the chaos. But I want to link this to one of the things that Mario spoke about, is that I believe that we are experiencing an epidemic of fear that is as pronounced as the epidemic of the virus itself, and that has psychological implications. And on a practical level, many psychological organizations in the United States are beginning to provide services pro bono to individuals and communities as a way of responding to this. I know that in Italy that there has been a strong push for psychotherapists to do the same thing, because in addition to the responses to the medical issues, the stress that has been put on families and children, and as you alluded to, Shmuel, the kinds of aggression that then gets placed in a family when that holding environment is not sufficient, really does mean that there is going to be a need for all of us to step up to that process in the days to come.
You've addressed, both of you, the sort of grassroots level about.
You're on mute.
I'm on mute?
No,
Hello?
you're not. No.
You've addressed, thank you. The two of you have addressed the grassroots level and the higher level. I was glad to hear you speak about leadership as an important part of the political SMO, because the leaders who are combining science and empathy with structure, predictability, and calm are having a far greater effect than those that want to engage in the kinds of things Zachary was describing in pre-contagion as denial or indifference, which are only sort of facilitating the aggressive outbursts. I'd like to tell you the next question, which is related. Confinement has promoted a lot of aggression towards governments for the perception that they are disturbing one's freedom. How does this relate to trauma? Do you have a thought about that, Mario? How does...
Well, what comes to my mind is just a small concept. The conflict between freedom and safety, and on another level, what has been worded out by many people in Italy, maybe I think worldwide, as the dilemma: should we die for the virus, or should we die for hunger, or economic ruin, breakdown? And I think that one point, a traumatic point, is that there is no clear answer to this question of this conflict, or a third view.
But
yeah.
I think to continue with this, I think the question also, in a way, touches on something which I thought was quite remarkable, because it came up at least in two, I think, of three of the presentations, certainly in my own and Mario's, about the, and what you said, Harriet, about the rise of paranoia, and which I think is one of the effects of the communal trauma, because of the breakdown of the integration, really, of the individual and the group and the external authority. So I think the question really points to the difficulty that people have in accepting government instructions, which are supposedly are there to be helpful, but the attitude towards them might be paranoid. So distrust, mistrust, and so on. So I think whether those instructions are correct or not is a different question. But what I'm saying is that the psychological way in which they're met is often one which stems from this kind of paranoid breakdown that you were referring to. Okay, the regression to the paranoid schizoid, which is one way of putting it, or the breakdown in terms of norms and values, the way I put it, on the social level, and so on. And there is no trust in what authority has to offer.
In what you suggest make me think that this is a special kind of regression, a kind of a regression in the service of avoidance. And what I think could be mainly avoided is the feeling, the unescapable feeling that there is a collapse of an omnipotence. And we all are confronted, not with a traumatic event coming from outside, but from the inside perception that we all are, our groups, our institutions, and societies are all vulnerable. Mm-hmm. When I say vulnerable, I don't mean weak. Also, the stronger thing may be vulnerable. And sometimes stronger people are more vulnerable because they are not supposed to be tired, to have doubts, or to need help, and they are charged and overloaded with many people problems. So vulnerability is the discovery, I think. But maybe we have not enough mental space to hold this vulnerability.
Yes,
I would
think
just want to add one quick piece before we go to the next question, but there is the possibility of the depressive position and the possibility of the reflection that can come from the depressive position that allows for the potential of a more adaptive response to the trauma. But we will see. I'm not seeing much of that, but that's a possibility.
Yeah, the question is, how do we reach that position?
Yes.
yes, and how do we communally achieve a sense of containment that allows for thinking? I thought the negative capability that Mario referred to and the sort of the capacity to remain calm enough to think and plan rather than act immediately is so important. I'm going to read the next question. And I want to say to our audience that our administrative help has requested that you might try to write shorter questions. I don't know if that's realistic because this is a very complex situation, but I'm asked to communicate that. So here's the next question for the panel. As analyst and patient are both involved in the communal trauma, is there a way to work in analysis taking into account the notion of trauma while it is currently happening? And even more, when many analytic dyads are living in different ways of isolation. Who would like to take this up? This takes us back to the analytic setting, I must say.
Yeah, yeah. You know, just briefly, I would say it's a very, very interesting and difficult issue, of course. I wrote something about that in response or in the wake of the Gulf War, when we had that experience. And I don't want to elaborate on this here, but there are situations in which we find ourselves as analysts with our patients in a situation that is absolutely traumatic in terms of the external capacities. And my conclusion, first of all, for myself, under those conditions was that if I cannot care for my patients, then I cannot see them. That is, if the external trauma is such that my need to be with, let's say, family, my own family, to be protective of them and so on, which can happen if you have to run to a shelter, you know, or an isolated room. Under such circumstances, I would have to say I cannot really continue to work. But on the other hand, if the external situation is such that one can continue to work, as I think the present situation actually is, with all the changes in the setting, then the analytic situation can go on. And remarkably, actually, in my experience, it does go on, where the patient and the analyst continue to work, not as if nothing has changed, but in a focus on what is troubling and what has been troubling and continues to trouble both of them. So I do think it's quite possible to pursue that, even though our usual external setting has been under attack, because, you know, we also have the internal, the internalized setting that we carry with us, and that very often our patients carry within them as well.
Well, you referred earlier to groups of very different sizes. The dyad in the consulting room, the family, the people on the block, the city, the nation. I was wondering if you could say something about the positive effect of a group, since many analysts are finding peer consultation groups very helpful at this time,
Yes.
helpful in order to keep their analytic mind intact as they're facing the same trauma as their patients. So this is a sort of a, what is the positive impact of the group?
Absolutely. You know, I think I refer to it in terms of this, the capacity and the need to feel connected. so that the group, when it exists and when it provides this kind of nurturance that is so needed, and to the feeling of being connected rather than being disconnected, isolated, and so forth, The breakdown that I think all three of us spoke about the attacks on linking, the incapacity to think. I spoke about the incapacity to symbolize, and so on, the need for a third. So these groups have been tremendously helpful, and it's no accident that they are jumping or flourishing up all over the place, because they are so important, and they allow us to really continue to feel our professional identity and belongingness to this profession and to what we do through this commonality that the group can provide. So it's really an anti-traumatic medication, if you will. It's the antidote.
I'm going to move to our next question. Would the panel please comment on the impact of culture on the response to COVID-19?
Yes, I've been doing quite a bit of work in this area and have held a number of other panels on that question, because we're noticing a very different response in more collectivist cultures than those that are much more individualist. Because so much of tradition and identity in collectivist cultures are about the connection of one to another. And whereas the individualist cultures are more concerned about the questions of isolation, the lack of liberty. And what we're beginning to run into, and this is beginning to express itself very powerfully and potentially violently in the United States, is how these two different perspectives are really clashing with each other. That I, as an individual, have my rights and my liberty, but the collectivist cultures are saying, then how do we assure that the group remains cohesive? And what is beginning to happen in that clash is different orientation to how we must respond in this moment. So I would be interested in the other panelists' perspectives on that as well.
Mario, you want to address that?
From another perspective, in a sense, because I want to witness an experience, a strange experience I had with my patients in these last days or weeks. One is more personal, is a feeling of being a child that is afraid of being abandoned, in the sense that the analyst may be depending on the patient coming to the sessions and paying, and I can feel something that is, I don't know if it's a transference or a counter-transference, but the fear of being abandoned by the patients. And I don't think that this is peculiar for this moment, but it was more evident. But another point that I experienced, I think it could be interesting, is that now, as ever in the past, my patient begin the session or during the session express a concern for my health, for me. It's true, I am a baby boomer generation, so I know that I'm fragile, in a sense, frail. But they express, I think, in a real way, a concern, a preoccupation for my being, my well-being, my being in good conditions. And I don't think, my feeling was not that they want to be reassured that I'm on the place, that I am holding the analytic function, but they are alive, really alive. Or as I thought Winnie could say, being being alive, being well, and being awake also.
Mhm.
And so I think that this could be something that can be exported in the general, in the social attitude. The preoccupation for the other is not so important who the other is, if he's below, if he's upper, if it's your son or your parent, if a leader. Don't ask what the government can make for you, but ask what you can make for the government, in a sense.
You know, an aspect of culture that you bring up, Mario, is also the vulnerable and the older members of a culture. And cultures differ in their level of respect for their.
Yeah.
There's so many aspects of culture that we might consider, ranging from that, you know, that so often gets turned into ageism, sexism, LGBTQ issues, childism, you know, and it is such an important time, I think, for psychoanalysts to speak out regarding the implications of that attitude. They're devastating for the culture and the social environment. And I think your presentations have helped us see what we could educate people about, what we could predict, what we could help them see. I think it's been really great to hear from you. Here's the next question. Could you elaborate on the difference between social violence provoking trauma and the pandemic as provoking trauma? Does that make sense? Difference between social violence provoking trauma and the pandemic provoking trauma.
You want to start, Shmuel, or you want me to start?
Well, I'll just say very briefly, I think it would again come back to the question of what is traumatic in the trauma.
Right.
So, you know, I don't want to elaborate on that again, so I'd rather hear from you, Zach.
Right, because I think that they're actually concurrent processes, because I think that the trauma is any kind of disproportionate experience that is disruptive to the psyche. And that is going to be, for some people, this experience of the pandemic is that kind of disruption. And it is distinct in what it is doing in terms of people's responses to it because of the level of disruption that it has and the differentiated level of disruption it has based on a person's life circumstance before the shelter-in-place orders got implemented. And also it has something to do with the cultural variables. What we're seeing is a disproportionate impact of the medical outcomes, health disparities based on culture. And so that does add to a sense of trauma. So what I think is important to understand, especially as we're working with our patients around this, is that their experience of the trauma related to the virus is going to be differentiated and will have some of the same components as one that comes from physical and social violence.
May I add to that something that I'm thinking of Mario's presentation where he defined the invisible virus, the invisible enemy, and social violence usually has a target, whether it's justified or not. And the pandemic trauma is, you know, related to something we can't see. And we really don't know if it matters if we take off our shoes when we come in the door, you know, very little things every day. So I think there is a different level of trauma.
Yeah, the virus is presenting, I'm sorry. Okay, the virus is presenting in a sort of an object aim disruption as well because of that invisibility. I think you're really speaking to that, Harriet. Thank you.
Yeah.
I want to add to what Zachary was saying before, all of which I think is true, but I would just want to add to that one's inner capacity, again, pre-virus or pre-social violence or whatever, to feel connected and alive. Because I think that on an intrapsychic level will determine whether or not the experience, which may be a horrible experience, but the question is, would it be traumatic? And I keep looking out for that point, because I think somehow we have been using trauma, not in this panel necessarily, but in general in our culture and even in psychoanalysis, in a somewhat wholesale sense, so that trauma loses its specificity, you know, and everything that is terrible and adverse and a calamity is a trauma. But I think you were talking before about the cultural difference between the individual and the collectively oriented cultures. Now, that's very important, you see, but it's important because it represents also an intrapsychic position of being more connected or less connected with others. So the vulnerability to trauma would be greater in the individualistic ones.
It is.
I'm going to move to the next question. Of late, the Indian government has suggested that people should learn to live with the COVID-19, as there's no easy and fast way to get completely rid of it. In this context, what is likely to be the new normal for people while maintaining their psychological well-being?
Oh, and this made me think that the same recommendation as of the Indian government has been said by many scientists worldwide, and also in Italy, where I live. The National Institute for Health Care said that we should be prepared for a long time not to live inside the pandemics necessarily, or the emergency, but to live with the virus. Also in condition of relative safety or security, but we must be prepared to live with. And I think that this may be an important lesson, not just for the general attitude, for being responsible, for instance, because if we live and we have some low level of the virus around, we should be prepared to live also with a sense of responsibility towards the other, and not to make to crowd the beaches or the streets as if there were no danger longer. But I think that this symbolically may represent the possibility of learning how to live with a sense of vulnerability. Again, I use this term because I think it's what comes to my mind. To living with one's own and our general as human vulnerability and our society, and get rid not of the virus, but of this sense of omnipotence, what kind of new global new liberalism or what else. That I think that money is important, but also human lives, and we should negotiate between money and humans.
Could I introduce this question? How can we think of childhood in these moments of confinement? Childhood in terms of trauma, in terms of normal development. As Mario was speaking, I was thinking that living with COVID-19 is probably, as best we know, different for the elderly than the very young. However, the very young in isolation are not developing in ways that we're familiar with as long as the isolation lasts. So it is, how can we think of childhood in these moments of confinement? We don't have any child analysts here.
No.
No, but I have children at home, and I can let you know that it is having a dramatic impact on their development. I have a son who is looking forward to going to college this fall and having his graduation. And the sense of loss and what that's going to mean. And I'm already imagining psychologically what it's going to represent in terms of those sort of rituals to have lost them. But I did a panel just yesterday on the welfare of children, and a lot of what the commentary was about was that there is this disruption in the developmental process of children. And as a consequence of that, this will be something that they will be integrating for the rest of their lives. And it's something for us to think about as well.
Anything further you'd like to say? Let's, if not, I'll move on to the next question. I mean, there are many things we could say about the socialization of children. They'll be spending so much more time on screen than they already were. And the need for us to advise and pay attention to parents and teachers and how to, continue to provide a lively environment for children to develop empathy, to have the physical contact that they need, and so forth. It is a matter of great concern. The next question is, although there's a great difference between war neurosis and new symptoms related to confinement in the COVID-19 pandemia, may we talk about confinement neurosis or a quarantine neurosis related to imposition of external reality?
Well, I think, that's an interesting question. I would defer answering that until somebody comes who I can actually understand or diagnose as having a confinement neurosis. In other words, I don't think I can project this at this point on a general level. We talked about when we coined the phrase war neurosis, this was not in anticipation, but it was after people had actually suffered the impact of combat fatigue and war neurosis. So we would need to see after this is over, or whichever way it will be over, as Mario suggested, will there be such neurotic pictures that will center in some way around this confinement? Now, I can begin to imagine maybe sometime, but it's quite difficult.
No,
but I do think we do have a sense of fragmentation around a sense of self that comes from the absence of being able to relate in a way, the absence of touch and what that is doing, especially for people who are sheltered in place right now, the differences in the kinds of holding environments in which people reside. I think all of those are contributing to a set of symptoms that we're beginning to see, but how that's going to define itself, indeed, it's too early for us to know.
Thank you. We have just 2 minutes, and I'll tell you a question that's come up that we can all be thinking about, and that is, how can we think of, where did it go? Excuse me. Has COVID-19 any positive effect on psychoanalysis? I was asked by an IPSO candidate a few weeks ago. No, I was told that the pandemic is a mortal threat to psychoanalysis. My own view was psychoanalysis has never been more needed, and that the more we have opportunities like this to talk with one another and reach the public, the better off the public and also the profession will be, because we have so much to offer. Since we have just 1 more minute, I'm going to move to the next slides that we have in the background before thanking the panel. I would like all of you who are attending to remember that there are more resources and information at the IPA website. That's www.ipa.world. And when you go there, prominently displayed will be this orange box, and it will take you to many helpful resources. Finally, I'd like to announce the, there we are, the upcoming webinar. There'll be another webinar next Friday at 12 to 1:30 Argentine time. This webinar will be in Spanish. Its English title is Otherness, Values, and Care in Times of COVID-19. And the panelists, Virginia Ungar, Jorge Bruce, Fernando Ordóñez, and the moderator, Luis Alejandro Nagy. So we have come to the end of today's webinar. I can't thank the panelists enough, Zachary, Shmuel, and Mario, and also our audience. Thank you very much for your participation and for your excellent questions. We will have a record of them and look forward to thinking more about your questions and hopefully at some point with you. Thank you very much.
Thank you.
You.
Bye-bye.
Thank you very much.
Thank you.